Okay. So I just want to welcome poster 10 session presenter Khudur. Looking forward to hearing her talk today. And, if you have any questions, put them over in the chat or head over to that presenter participant booth and engage there. So without further ado, I'm going to turn off my camera and give the floor to you.
Thank you. Thank you so much. It is such an honor to be here today. Hi, everyone. My name is Khudur. I'm currently a fourth-year Doctor of Public Health student, and I'm also doing my fellowship with Johns Hopkins University, TL1 program, and in addition, I am also an epidemiologist with the CDC Foundation. So today I'll be presenting on COVID-19 and mental health, comparing the mental health between African American and white in 2019 and 2020 using the NSDUH data in the United States. And that data set stands for National Survey on Drug Use and Health. And my chair for this project is Dr. Hossain, and my Johns Hopkins University TL1 advisor is Dr. Saha. And I just want to let everybody know that this is a research in progress, so I'm still working on gathering the results. So just to give you guys a little bit of some background, so although African Americans make up 13% of the US population, they account for 1 in 3 people who have been hospitalized with COVID-19 and 3.7 times more likely to succumb to COVID-19 related death than whites. For many reasons, African Americans are at an elevated risk for COVID-19 exposure and related hospitalization and death. COVID-19 pandemic has further unveiled the distressful reality of racial disparities in the United States. African Americans are bearing a disproportionate burden of morbidity and mortality due to COVID-19. In many cities like Chicago, African Americans are only 30% of the population, but they make up more than 50% of COVID-19 cases and 70% of COVID-19 deaths. Okay, and just to give you guys some further background, so COVID-19 and mental health is not just in the United States, it's also globally. COVID-19 pandemic triggered 25% increase in the prevalence of anxiety and depression worldwide. So now bringing it back to the US, African Americans are experiencing trauma and mental health issues for many different reasons during the COVID-19. Anxiety, for example, anxiety from not being able to follow the stay at home orders to protect their family due to their job situation, also being separated from families and friends, not being able to visit the hospital for their loved ones. Also, grief and loss of family members, emotional stress, and living in close corners, also losing jobs, not getting access to health care, and many other reasons. For much of the pandemic, services for mental health and neurological substance use conditions were the most disrupted among all essential health services. And now let's look at I'm going to provide you guys with some statistics from the US Department of Labor. So the US Department of Labor report that only 18% of African Americans have jobs that allowed them to telework compared to 26% and 32% of whites and Asian respectively. African Americans are more likely than white to live in cities and in close corners where COVID-19 can spread more easily. In addition, African Americans are twice as likely as whites to have no insurance. These social economic pressures and health risks can put African Americans at greater risk for trauma, grief, and other mental health issues. So now here, I really wanted to, the issue that I'm really focusing on here is mental health between whites and Black, and not just for this pandemic. I mean, it's great to kind of like focus on COVID-19, but then also the results of this study can not only support COVID-19, but also other pandemics that might be underway. I'm hoping the results from this study could strengthen mental health and psychosocial support services as a part of strengthening preparedness response and resilience to COVID-19 and also other public health emergency. And then also just updating and improving on our comprehensive mental health action plans for the future. So this was my specific question. So specifically, I asked, are African Americans adults more likely than whites to have mental health issues in 2019 and 2020? And so my study design was pretty much a secondary data analysis from the National Survey on Drug Use and Health. My sample size is 42,739. Again, I was specifically looking at adults. So that's age 18 and over. And so some of my main measures, I'm looking at major depressive episodes, drug use, and taking medication for mood. So this is kind of my variable list. There's a lot of information here, and so I had to look through to look exactly what are some of the variables that I'm interested in. And so, what I plan to do is do the data. I plan to analyze the data and conduct a univariate analysis describing the study population and also a bivariant analysis, specifically performing chi-square. And then I'm also thinking about doing several logistic regressions. So here I do have some results, but these results are only descriptive statistics. I'm planning to do the rest of my results and analyze the rest of my data in the near future. So as guys can see here, this is a breakdown by age. As you can see, my total sample size is 42,739. And this is just a further breakdown of each age group. Here's the breakdown by gender, by sex, a male and female. It's almost split 50-50, close to 20,000 males and 22,000 females. And here's the breakdown by race. Of course, whites are 25,226, and African Americans are 5,475. And then I also specifically looked at different regions. I wanted to look at different regions because once I produce my final results and conduct my final analysis, I wanted to make sure it's very targeted. So looking at large metropolitan areas, also looking at small metropolitan areas, and also taking into account rural areas as well. And here are some resources. One of the resources that I found very helpful. So guys feel free to share these resources with your friends, with your colleagues, or anyone that needs them. One resource that I really want to highlight is the NAACP coronavirus resource. It has kind of like reporting discrimination, tell your story, also submitting questions and other resources. There's also hotline, crisis hotlines, and other things of that nature. So feel free to use some of these resources. And as I mentioned, I'm really looking the results of this study. I really wanted to strengthen mental health and psychosocial support service as a part of strengthening the preparedness response, not only for for COVID-19, but for future pandemic as well. Right now, I'm working with the CDC Foundation, and we're trying to help different facilities and things like that return back to normal. But as we're returning back to normal, we also have to remember that COVID, even though that COVID is coming to an end, there's a lot of stuff that we need to address, such as mental health illness. And now, since we have the world attention, and that now that public health is in the forefront, we really need to advocate not only for public health, not only for mental health, but also for these marginalized community to get the attention that they need. So hopefully with a study like this and with other studies, they could really drive programs and really drive preparedness effort. Thank you. And if you guys have any questions.
Yes. What an amazing presentation. Once again, we have been so fortunate today. I really, I can't wait to share your talk with even more folks. Look in the in the discussion to see if there's any questions there. And also, I hope you'll have some time to head over to our participant presenter booth in order to field any questions in that space as well. Again, excellent presentation. And, we're always in touch. So I look forward to talking with you more about your work and working with you in the future. So thank you.
Absolutely. Thank you so much.
So, and I hate to rush off, but I got to go to poster 11 while you go over to the booth. Okay.
Sounds great. All right. Bye.
Bye.